Hello viewers, welcome to the Lungleng show again. Today, this is going to be a very interesting conversation. And here I'm with a person who has done 21,000 surgeries in his life, in his professional life, for over the span of 22 years. Imagine just 21,000 surgeries that he has done. That includes, of course, major as well as minor surgeries. And he is Dr. Deep Ghosh, and he's a doctor practicing at the Apollo International Hospital in Guwahati. So he has just come here to have a conversation on how spine surgeries. And he's orthopedic spine surgeon, of course. He's an orthopedic spine surgeon. And I think this will be very fascinating as to understanding how human spines work and what are the deformities that we see in human life, in human body, and how those can be corrected through surgeries. I think this topic is already quite interesting when you think about human body and the surgeries that involved around our human bodies, and a lot of deformities that human bodies, face in our day-to-day life. And it's going to be very interesting. He comes all the way from Guwahati to have this conversation. So thank you so much, Dr. Ghosh, for joining in this conversation.
Yes, thank you a lot. And at the outset, I would like to thank the people of Nagaland. They're very friendly. It's been a very nice trip for us. It's a lovely place.
Wonderful.
And it's a very beautiful place. And we had been a guest to one of my patients, and she is also a scoliosis patient.
Okay.
So we were guests there. They were lovely guests.
Wow.
Who helped us.
Okay.
And they even dropped us to Kohima. So
From Dimapur.
So again, great thanks to the Naga people.
So you said it's your first time in Naga?
Yes, it's with my team is the first time. Myself also first time.
Okay. How do you like the weather here?
Excellent. Not that what we faced in Dimapur,
Right.
but when we came here, it was excellent climate, excellent views. But I think the traffic is a bit.
It's horrible. I know, it's true.
They maintain the lanes. That's a very good thing. But I think you should have more technology instilled.
Exactly. I think that's what everyday people faces, that kind of issue. Like when you go to the office, you have to sit in the car at least for 1.5 hours sometimes.
Yes, now digressing from that point, there is one transit system that is known as the gondola system. It has been used in some South American countries like Bolivia, La Paz, and those things. So they use these aerial tramways to transit, and they are very good for cities like this. So
Right.
So I will come back to spine.
Yeah. Okay, that's a good suggestion. Yeah, I'm sure people are thinking. Let's see. So you have done 21,000 surgeries in your lifetime over the span of 22 years.
Yes.
I mean, is that even humanly possible?
Yes, it's possible because we do we work as a team. Sometimes there are 2 or 3 cases or 4 cases. Sometimes there are minor cases, so they add up that way.
Right. So those are mostly, like you say, including major as well as
minor surgeries. Yes.
So you studied. Before we begin, let's set the context. You studied. First, of course, you must have done your MBBS.
So I did my MBBS in Guwahati Medical College, and I passed out in the year 2002.
Wow.
So after that, from 2003 to 2007, I did MS Orthopedics in Guwahati Medical College. After that, I did training in orthopedics, general orthopedics in Delhi till 2000. It was 2010. From 2010 to 2014, I did various spine fellowships, including fellowship on National Board of Spine Surgery. It's a super specialty degree in spine surgery that I did in Delhi, in Sir Gangaram Hospital.
So, of all the spine surgeries that you have done, like what were the most crucial or major deformities that you see?
Yes, any surgery is a big surgery for me because even if it takes half an hour, if it's 2 hours, but there are certainly these deformity surgeries where sometimes the time period stretches up to 8-9 hours. And preparation time can be 1-2 hours, so it's a huge. It's an entire day procedure. And it's a huge thing mentally for me and for the team, and physically also, because I have to stay all long. So the surgery might take around 6 hours or 7 hours, and the rest of the time are getting the patient prepared position. Then you use neural monitoring, that is put up wires into the patient's body so that the surgery is done safely, and then after that also it takes some time for the patient to recover. So it's a long procedure.
That's wonderful. I'm sure the technicalities people will not be able to understand.
Yes, surely.
Yeah, but I just want to know, as a common man, is it safe to do surgery? Should I not be scared of the surgery?
At the end of the day, I'm a surgeon, but I will say, if possible, surgery should be avoided.
If possible.
If possible. Whenever possible, surgery should be avoided. Surgery should be seen as the last resort. And there are certain times when we advise patients that surgery is necessary, but they don't want to have it. So that's a bad thing again.
Right.
So obviously, nobody wants to undergo surgery. If I would have some spine problem, my first call would not be surgery. Definitely not. I will try to go by the normal method.
Right.
Then only if I feel that, or when I'm a doctor, I will explain to the patient that this is a time you require surgery. That means you require surgery. So then if you delay, it becomes worse.
Exactly. So of course, that's the surgery is the last resort, and I have to do it, for example. In that case, from your experience and from the expertise that you have, can you tell people that no, don't worry about it, it's quite safe?
See, nowadays, whatever technology we have, it's becoming much safer than what was earlier.
Okay.
So nowadays, we have advanced anesthesia techniques. So those are medical problems like diabetes, pressure. They can be well controlled and they can undergo surgery. Then our sterilization techniques have improved. Our OT system have improved. The machinery in OT has improved. So of that, and we now use endoscopes, sometimes use microscope and loops. So that gives magnification and visualization. So in that way, the risk of surgery has gone down much than earlier. And then in deformity case, it's a thing called neural monitoring.
Okay.
So it's a very special thing. So what happens in spine surgery, the main risk is about any damage to the nerves, because in the spine, inside it contains the nerves. Now, if the nerves get damaged, sometimes you could have temporary weakness and numbness of one limb, or sometimes even in worst cases, you could have paralysis also.
Wow.
So it's a very, very rare situation, but it is quite common in deformity. So having weakness and these things is around 4 to 5%. So it's a significant number.
Right.
In very bad cases of deformity, it could be ranged up to 10%.
Okay.
It might not be permanent. So in that case, we have this machine neural monitoring. So we wire up the skull, we wire up the entire body. So we pass signal from the brain into the lower limb, and back from the brain, from the lower limb and the upper limbs back to the brain. So that is monitored, and spine sits in between. The signal is disrupted, that means the spine, there's some problem in the spine. What I as a surgeon might do, he is somewhat injured. So that knowledge is very important. So then we can do, okay, this is one thing that I have done, and now the signals are down. That means now I should reverse or try to mitigate that problem. So that adds a huge layer of safety to the surgery.
Okay.
So it's quite safe, but nevertheless, I will never say that it's 100% safe. I will never say that.
Yeah.
It will be a total falsification.
Yeah.
There are risks and complications, but you have to understand what you gain from the surgery and what risk you have.
Exactly.
See, if you try to cross this road and some mad guy driving a car very fast, he might hit you, and you could die or you could be injured. But it doesn't mean that it will happen every time.
Yeah.
And it doesn't mean that because of that fear you won't cross the road.
Exactly. I mean, it makes sense.
So that way means we have risk, but we have to understand the risk. We have to know what gain you can have with the surgery,
Yeah.
and what are the risks. And if the gain is much more than the risk, I think the surgery is a perfect thing.
I like that argument. You know why? Because you came all the way from Guwahati, and you could have met accident as well.
Yes.
So like, I mean,
Yes,
I'm not praying that you met, but
Yes,
just
but means,
the analogy.
That's talking figuratively. It could
Right.
happen that
Yeah,
way.
could happen. But there is nowhere like 100% safe.
No,
in anywhere
one
in the
like
world.
100%.
That makes sense.
So, see, if you go and ask your surgeon, is this 100% safe? Is this 100%? So there are certain scrupulous surgeons who would say
Right,
no. This is 100% safe, but he's taking you in a, for a ride.
Yeah.
Because there's nothing like that. Surgery being so very complicated, you could last somewhere. But I think any surgeon who gives you overview, what can go bad, what could be the advantage, that's the proper way.
Absolutely. So that you take the patient's consent.
Consent,
Yeah.
and he should be aware what is being done.
Yeah.
He should be involved in the decision-making process.
I'm sure that is very much an integral part of a medicine practice.
Yes, now
practice.
this is what is accepted,
Yeah.
and now it is much more rigorously followed than it was, say, earlier, 20 years back. Now it's much more rigorously followed. This consenting, because of a lot of litigations and rules from the government, has become much more enforced nowadays.
So, in your experience of practicing surgery for the last 22 years, which one, or do you have a case where it took you the longest hour ever to complete that, and not in terms of complication, but the major effort that you put in and it came out as successful?
Yes, there are many cases as such, and some are in the process of being, we are doing. So, in deformity, it might not be that the surgery is one all and end all.
Oh, okay.
Sometimes we have to assess the patient, then we have to give something like traction, and then we have to do serial x-rays, and slowly the patient becomes better, and then we go for surgery. After surgery, sometimes they still recover. So they recover a bit. So sometimes we have to go for 2 surgeries. So there are things like that. So, and if you say a single case, it's around 14 hours.
Whoa. And you focus mostly on the deformities, right?
Yes, my personal gratification comes from deformities. It's a area is not very lucrative, frankly speaking. But the satisfaction that you get from such a patient, the patient coming with a lot of deformity or even wheelchair bound, and then they are working, and that feel you get from the parents, the love you get from the patients, enormous. So I think it's it cannot match any monetary value, but that is my calling rather. So I try. This is why I came for this podcast, is to disseminate this knowledge that there is a problem. Some people have it rarely, and though not that rarely, it could be 1 in 1,000. So in 1,000 means in a village you could have 5,000, you could have 3-4 cases like that. The deformity is fine, though there is now treatment there. So identify, we can work on that patient, and we can have good result and make the patient back into the society, put him back into the society.
Absolutely. I've seen your pictures that the patients that you have treated. Some patients' spine and the back could be as crooked as the letter S.
Yes.
But after surgery, do they get better? And
yes, definitely they get better. But it might not be like absolutely straight line, but some means it's for every practical purpose they are back to normal.
As long as it improves the quality of life.
Yes, definitely
it
improves the quality of life. It improves the another great thing is that it mostly happens in young ladies. So their body image, their means that they have an image of the body that improves a lot. Now, see, if you have a crooked spine, if your torso is bent, so even if you wear very loose fitting clothes, you can be picked up by anyone, particularly by classmates. And when the classmates start nagging what has happened to you, and then they give some name, the crooked one or something like that. So it's very kind of demoralizing for the patient, and so that thing also, that fear of the look of the crooked spine goes away.
So is it mostly genetics, like hereditary, or it could happen to anyone also?
See, there are many forms of this deformity, but the most common type or the most prominent type is adolescent idiopathic scoliosis, and that is mainly genetic. So it will not be like that if a say mother has it, the daughter will have it. But it could run obliquely. That means the mother, her niece could have it, or her granddaughter could have it,
Right.
or some distant relative could have it. So that's a possibility. Sometimes in the same family, the elder brother has it, the younger sister might have a worse form.
Correct.
So the elder brother might have very minimal. You need not go any surgery, did not go for any intervention. But the younger sibling, the female sibling, could have a much bigger
Worse
deformity, worse form. So these are variations, and there are other forms, like you could have this scoliosis from some trauma, some fall, accident. Those are things are there. Even in case of some tumors or some cancer or some non-cancer tumor can also cause it. So there are rare causes, and mainly it's the adolescent idiopathic scoliosis that happens in kids of around 11 to 18. These are the teen, the really growing time, and affects mainly the females.
Okay. Wow. So in your experience of doing all these surgeries, like I mentioned, 21,000 plus going on, which is just amazing. If you happen to believe in God, but Bengalis, there are a lot of atheists, but I'm just assuming that you believe in God. When you open people's spine, human spine,
yes,
can you explain it to me and my audience how beautiful and how intricately created those spines are?
Yes, means one thing I have seen that beyond the if you what is beyond the skin is almost same for everyone. It might be some Hindu, some Muslim, some Christian, but the structure of any race, the structure is the same there. So you have these muscles, you have this intricate interplay of muscles, you have intricate interplay of the bones, and then you have these ligaments out there from there. So you can. It's a very beautiful God's creation. Obviously, very beautiful, very intricate and very balanced way. A lot of things, even we know, say drop of it only.
Wow, I know. It must be quite, how to say, speechless actually. What was your experience when you did it for the first time?
See, actually, the way we do it is under supervision first.
Right.
So at that time, it's like because it's quite deep inside. It was a kind of obese patient. So we could not see deep inside. It was difficult because it was kind of one hand length down the bone. So we could not see. So at the time. So later on, when I start doing, then we could see more of those things.
Right.
Muscle.
That's just beautiful. I think, and what deformities are mainly caused by, like you say, it comes from genetics, hereditary, and so on. But some people could be start, hunching and slouching also when they grow older.
Yes, actually, see, this has been a big debate among the surgeons. But see, hunching and slouching sometimes might not be due to the patient themselves.
Okay.
It is how the spine is built. So these are newer things that we come to learn.
Achha.
There are different types of spinal curves, type 1, type 2, type 3, type 4 curves. Some people, they already have that hunch.
Right.
Inbuilt in the spine.
Okay.
So those you can, with exercise, you can do some amount of correction of that, but a full correction is not possible. There is something called, see, you have your hip and your pelvis.
Right.
That is intricately linked to your hunch.
Okay.
Those who have abnormalities there will have a hunch. So it's not that simple that the person is lazy and he is sitting hunched. No, that is not. I think that's a very wrong take. If you see scientifically, it's mainly means the way the spine is built. On top of it, you can help somewhat to keep your posture better. So it will help in your back, the backache. Everyone has it, I think. I have it, you have it at some point of time. So that decreases if you maintain the posture. But you cannot be very kind of zealot in it. It's not possible, because at the time, if you are going against your natural curve of your spine, you could do more harm than more good. Still, if you have some improvement with your posture corrector, etc., you can use it.
Okay.
But
Yes.
As from scientific point of view, yes, you can use it, but you might not have that amount of correction.
True. Because that's how you're built.
That's how we build. But yes, if the patient is elderly and their spine starts bending up, then that posture corrector helps. And
Okay.
not in very young patients.
Yeah, some people without putting any effort, their posture is straight and upright, and they don't put any effort. But some people, even after putting effort, nothing changes.
So you can you can change by very few degrees that, and another thing is that you have to make entire body fit.
Yeah.
So if you have a fit body, it's much better. You can lift things, and be careful while you lift things. And see, injury, back pain doesn't start say till 20. After 20 it starts. So now the body is not that young, and if you start lifting things abnormally, start sitting abnormally, putting more pressure on your spine, so you will have problem. But on top of it, you have a genetic background. That's a thing, because it has been studied in studies that if you have identical twins, they will have the similar type of, they might be in different cities doing different jobs. They will tend to have similar type of spine, similar type of slip disc in similar levels. So that underscores the how genetics work in it.
So in your career of doing all these surgeries, there would, in our society, you are the one top % who has the knowledge of spine, how it works, and so on. So how do you care for yourself? Knowing fully well, or
See, it's a kind of what I feel is kind of deal with the devil.
Right.
I keep on saying, sitting more than 1 hour at a time is difficult, and it's bad for your back. But sometimes in OPD I might have to sit for 7 hours long, constantly. So that is life.
True.
So it has to be improved, but that way sometimes not everything can be done.
So what you're recommending is don't sit for more than one
Don't
hour.
sit for more than 1 hour at a time. Don't stand for more than 1 hour at a time. You could do it, but sometimes if you have back pain, if you are prone to having back pain, and if you do it, you will have more back pain.
Okay.
See, it's because of sitting, the disc pressure.
I want to know that now.
No, because the disc pressure is the highest. Because in this point, we slouch a little bit. The pressure on the disc is highest, and more so if you think you have dropped a paper on the ground and you are picking it up. That is the highest
pressure.
Pressure on the disc. So there are bones and there are discs. Discs are like tires. And the tires have air in it. Here you have a liquid disc in it. So that liquid gives you some movement of your spine. Otherwise you will be very stiff. If somebody calls you can't see back. So that gives some movement. That gives some protection from walking, the shock absorption.
Shock absorption.
But that is the main culprit for a lot of things. You have this back pain, you have this slip disc, all these problems are on this. So that's a very weak part how God has made. So, and this weak part sometimes causes problem, and particularly if the disc pressure is high, it starts problem, like it can leak out. It leaks out in the front where there are nerves, and then you start having leg pain, back pain. And this is the problem with slip disc.
Okay.
Now, if you see, now coming more from this creation part to the scientific part,
Yeah.
see, we were initially quadruped. That means we used to walk on 4 limbs.
Yeah.
Slowly, we went up,
Okay.
and we are straight.
Uh-huh.
So in animals, those who have 4 legs, these mammals,
Yeah.
their spine is not that pressurized.
Correct.
Now, when from chimpanzee ape to and we have become humans,
Yeah.
we are now standing
Upright.
erect. Now we have more pressure. So that is why it fails so much often. So there are certain. Sometimes people ask me, why did I have this slip disc? So there are a lot of answers in it, and one of the things that is how we have changed from being a from we have evolved from a 4-legged animal to a 2-legged animal and standing erect. So it's some kind of you can say payment we are making for being erect. Some kind of tax we are giving.
The risk.
The risk.
Okay. Well, that's beautiful. That's a new knowledge for me as well. Thank you so much for shedding light on that. Wow. So people have to go to gym to do all that work. So are you also saying that if we gain more weight, does it also put more pressure on our spine?
Yes, it has been seen that if you gain weight, it poses more, but it's not that linear.
Okay.
Gaining a little weight is better. You have less back pain. If you are very thin, you will have more back pain, more disc problem.
Why is that?
It's perhaps means when you are very thin, the discs also become weak, the walls become weak.
Okay.
Till you are a bit not skinny, a bit obese, it's okay. Once you become more obese, then you will have more pain.
Okay.
So it's a sweet spot.
Well, that's interesting. Last year, a few years ago, I took my mother to a hospital and see the ortho, and they said the bones, the back pain, the backbones is now, since getting old, it's getting dried. So you must be talking about that this liquid.
Yes, this liquid can leak out, can get dry.
Yeah.
So once it becomes dry, what happens is that now the shock absorption doesn't work properly.
Right. So the bone hit each other.
Not kind of hit, but they're more. Now they have more impact.
Okay.
Okay. And there are other things like the certain amount of nerves go inside, so the nerves get there. They were not initially there, and they come there and they cause pain. Then you have pain from there are other joints in the spine. These are known as facet joints. Then there are other things like even if you have very weak bones, you start having small fractures. Small fractures unknowing, then you start having pain. And then what happens is that this is the normal position of the posture of the body. With aging, your bones become weak and you start having go forward slowly. Right. You start bending forward. Now, once you bend forward a considerable amount, so see, if you I will say like how can I explain? It's like, say if you put your pen erect, you can perhaps balance it.
Yeah.
So that goes. Can I have your pen?
Yeah.
So. Or if it's...
Can you take the pen?
Or if it's lying flat on the kind of bed,
right?
It's stable. That's okay. But if you try to balance it this way, it's very difficult.
Like in diagonal.
Diagonal. So if you are bent too forward, so you cannot balance. So now your muscles have to work more. You are prone to fall more. You fall more, again have more injury to the back. So that's a vicious cycle, and slowly the patient goes down that way.
So there's no way to prevent it. It comes with age.
There is nowadays a lot of things to prevent it. So, see what has happened after the year say 2000 is the start of the molecular medicine.
After 2000.
After 2000. So they have some precise medicines to target those molecules that we need. So in osteoporosis, there's a medicine known as teriparatide. So this has been a game changer. Sometimes it can go over your head, but so what happens is that we target specific molecule known as rank L.
I see.
So that molecule attaches that and it destroys that, and that is the signal for making your bones weak. Now, if we cut off the signal, your bone becomes significantly, increases its strength. So we are basically we are trying what nature is trying to do is put you into trouble.
Right.
We are trying to
Reverse that.
reverse that to some extent. Yes.
Is it picking up? Is it working?
It's working excellently.
Wow. And you have that facility even in your
Yes,
hospital?
yes. Even I think in Nagaland also, doctors are prescribing it.
What is it called? You said it's a molecule, something, right?
Yes, it's a teriparatide.
Teriparatide. Okay, we need to Google that.
So see, nowadays what has happened is earlier the medicine were some small molecules. Now there are large molecules, and if you have a troubling chemical in your body, they attach to it and disable it.
Okay.
So that has started after year 2000, and there's lots of medicine in diabetes, in osteoporosis, in cancer. So that has kind of revolutionized, and in rheumatology.
Amazing.
That has revolutionized medicine. Nowadays, they are very costly. The one thing, so that is the big problem, because they are costly to build, maintain, and when they have to come by a cold chain like vaccines. Another thing is that many medicines are covered by patents, by Western countries, and they charge a lot. And they take their pound of flesh.
I'm sure.
So that is why these medicines are sometimes very costly, but they work. The cost has come down than initially it was. The cost has come down significantly, but still, means kind of a poor person will find it difficult to take it.
Correct. Wow, that's amazing. So I think a lot of people are doing, lifting heavy weights, deadlifts and all, and they're saying this is good for your backbones, this is for your back, and I'm sure, but according to how you explain, it's going to put a lot of pressure on their back.
Yes, but
how does it serve?
The back is not a static thing; it's a dynamic, living thing. So what happens that till a level, if you put weight on any bones, the bones get strengthened up.
I see.
Till a level, and it works more in case of younger people. But it gets worked out. So that is the way. If you do some exercises, it's good for you. Some could be different for everybody. Some would very little exercise. Some could undergo very rigorous exercise, but they can do it. So exercise is basically good for your health, good for your bones.
So that means there's a strong connection between weightlifting and the medical benefits, right?
Yes, definitely they are medical, but one should not overdo.
Yeah, of course.
You could have back injuries, etc. Till a level, exercises are very, very good for the bones.
So now coming back to your, let's say, the hospital where you work, in Apollo International Hospital. Apollo is known for its name, for its expertise and reliability and so on. So, I mean, you must be getting different kinds of patients, right? And like you said, you mostly deal with deformities. But people sometimes can be coming from who made accident on the roads and so on. And also sometimes people have, to the point of having a patient who wants to, let's say, grow their height.
Yes,
there is a practice going on.
Yes,
is it worth it, or is it good?
Actually, it takes time. There can be complications, but it is medically possible.
Wow.
But it could take something about 1 to 2 years. And see, the person who will like to increase his height will be someone who is very finicky.
Yeah.
Finicky means he's not comfortable with his body image.
Insecure.
So those patients, they are difficult to manage for 2 years. It's very difficult. It is painful. Wow. It takes time. Sometimes there are complications. There could be infection, etc.
Right.
For something, yes, you will gain height.
Yeah. Up to how many inches or centimeters?
See, each bone we can go at around 3 centimeter, 6 centimeter.
Wow.
Sometimes cumulative we can have up to 10 centimeter.
So easily 1 or 2 inches, though everyone can get it.
No, it's not an easy surgery.
Okay.
First, Second thing, it requires a lot of time. So it grows slowly. There's a kind of procedure that is known as Ilizarov. So we slowly distract the bones, and slowly the bone starts going. Now mainly the bone is the important thing. The rest of the muscles, etc., will elongate with the bone slowly. So that elongation might itself take 1 year. And on top of it, you have to keep it for a few more months for the elongation to now solidify. Initially, it's a very weak type of bone. So, and that Ilizarov procedure, you have a lot of wires, etc., coming. It is painful. Sometimes the wire ends can have infection. There's another way known as the LRS system. That also have some kind of rods going in. So, it's a horrendous type of surgery. It's possible. There are other machines also nowadays that is not available in our country. We could do it internally also. There are a lot of things we can do. Yes, it's definitely there. But my take is that the one who tries to do it, they are very short-tempered ones. They don't have that time. They are very frazzled with small complications.
They can't wait for 2 years.
So they have difficulty in waiting for 2 years, and there's a big problem in such patients.
But they have to make a proper decision before the surgery.
Yes, you have to. You have to talk with other patients who are undergoing that. You have to know. It may take around 1 month or so, and if you are convinced, yes, you can have it.
But once it gets fully solidified and recovered, does it get back to something like a normal human being? I mean, human body, or there will be some weakness where you can't play football, for example.
No, the weakness is there, but it's very minimal.
It's minimal.
It's very minimal. It is not that. So if the process is very successful, completed, very minimal weakness is there. So otherwise you will be normal. Another thing is that you will have some kind of disproportion. Now it's difficult to elongate your spine. It is possible, but difficult to elongate your spine. So you will have a longer this leg. And a shorter back. So, but it doesn't matter. Means mostly it will be covered with your clothes. So it can be done. Definitely, it can be done.
But it may not. It may not be worth it.
Yes, it may not be worth it, and means I told you, those people seeking it. It will be difficult for them to reconcile to the fact that they have to be bedridden. Sometimes the pain is enormous. You have pus. Now that is that treatment we do for someone who has accident, bad bones, fractured. So their motivation is different. They want to go back to normal. Now they have motivation, something that they were normal, almost normal earlier. For the sake of cosmetic looks, they are trying to get abnormal and then back to normal. So,
correct. Yes. So in the world of ortho, I don't know the actual name. How would you say it? But in the world of this
orthopedics,
is there a discussion or an attempt to invent further on, artificial spine and so on?
No, there are things. When we entered medicine, say in the 2000, etc. There was initial thing, a lot of molecules. We thought that this is all. There is nothing new to. But every month, every year, we come to get newer things. The process of innovation will continue. This is the march of humankind. This will continue. Newer things will come. There are things, but something means it will take some time. We have artificial disc also there. Things, but complete. One of the biggest problem now in spine is that the spinal injury. It's a very big problem. People who have spinal injury and have kind of very severe type of spinal injury, they don't recover. You see, if you have a cut in the skin ends will come together and it will join. Even if you don't do stitching. If you have some injury to the muscle, it will heal. If you have some fracture of the bone setter will do something, but it will, even if you don't do, sometimes they have a tendency to heal. Most bones, it will join together. But nerves, particularly the spinal cord, doesn't heal by itself. That's a big problem. So we have a lot of patients who have injury to the spine, and so once they have injury to the spine, they're kind of paralyzed. Like you might have heard about the Christopher Reeves, the Superman.
Acha.
He had a accident while he was riding a horse,
Okay.
and then he was paralyzed from neck down. So his spinal cord got injured at the level of the neck. So there, the recovery is very unpredictable. Sometimes we have seen recovery in few patients, very few patients, but mostly the recovery in most patients are very less. So that is a problem. Like we don't have a hold on it. We are still very backward in its treatment because of certain things. There was use of stem cells, but it came out to be of no use. Nowadays things are moving fast, and you might heard of Elon Musk.
Yeah.
He has another company known as Neuralink.
Neuralink, yeah.
So what they try to do is that if you have this break in the nerve, they are trying to put receiver in the upper part and put a transmitter in the lower part. And with your computers, they are bridging this gap. So some movement is possible. There have been others other than Neuralink also, that some movement is possible. This is known as spinal cord stimulation. So that is possible, but it's very experimental in stage. But only that is seems working now. All the other treatments like stem cell, etc., didn't work out, didn't pan out that way. So this is the thing. That may work out, but it's experimental. It's very costly. Things like that, and you might not be having a very, very natural movement. You might have something like robotic type of movement.
True.
But it's better than having nothing.
Yeah, exactly. Yeah. So I mean, this conversation has been very, very insightful. But what would you suggest to our viewers, for example, if they want to take care of their spine, if they, like not to get deteriorated, but in order to build better? And
yes. First, there are a few things. So first, if we start from diet. So one thing is diet is having a balanced diet, having everything.
Okay.
Everything means also healthy amounts of fat, less of sugar, more of carbohydrate, more of proteins, and more of say kind of fiber.
I see.
So things like fruits, vegetables, salad, etc. So and then they should be more in the sun. So to absorb, to get more vitamin D, exposed to the morning sun. So this is one part. Second part is that they should have adequate sleep. Okay, sleep is kind of reparative. If you have any injury in the body, this is the night time at sleep, it gets repaired. You have some injury in the back. If you have adequate sleep, if you take adequate rest, you will be better. If anyone has a back pain, he will remember that sometimes it had pain. It had given him or her an opportunity. But he started doing more work, perhaps because of this modern life. And then his back pain became worse. Yeah. So that's the thing. So that also increases the immunity. Fourth is not to have, means to limit smoking. Smoking is very bad for the spine.
Oh, okay. Not only for lungs, huh?
No, very bad for spine. Okay, it increases slip disc, it reduces the, and also have alcoholic drinks in very low quantity, that much. So that is the way. So from the diet, now coming to your posture, etc. One is take adequate rest. If you are standing long, try to take some rest in between. Like those who are teacher or policemen, working there in the streets in the harsh sun. So they should be taking some rest in between. Like if you are a office worker working in a bank or something, you should be taking sitting for a long time is also bad. Okay, now fourth thing is you can go for some exercises, aerobics, some weightlifting, whatever you feel. Some people might go for yoga, etc., or tai chi. So whatever you feel is good for you. Then the thing is that posture in your workplace. Like you could have you could choose your seat, chair, that adequately suits you. You will find that some chair, if I sit there, I will have back pain.
Yeah.
So this is one chair that might be comfortable. So make your part very comfortable. You can have a back support here. It's a bulge, so that matches your bulge of your spine.
That helps.
That helps. And sometimes some people have problem with low back, so they might require a bit higher back. So those things, then you can have your foot adequately planted on the. You can have a kind of stool, small stool to rest your foot. And then the computer, etc. Actually, see, if you put your neck too much down, like if you are using a laptop on your lap, so down, that creates a neck problem. And also, by corollary, it causes back pain, because once you put your neck down, next the stretching is on the back.
Right.
The small things. You can have a screen just around, just a little bit down from your eyes, so you don't have to knot too much. If you have something like a keyboard or some paper from where you read and then you type, so it should be just at the level, so you need not too much and see down. While using your mobile phones, try not to do this. Sometimes I might be also guilty for doing this, but try not to do it. Try to put it this way. And listen to your body. If your back says that you have some problem, take some rest. That's the way. And once everything you have done well, and then your luck is bad. So if you have some pain, for some small pain, you can have some hot water put you in your back, take some rest. Do this, put some ointment, etc. But if you feel now the pain is too much, visit a doctor. Don't try to self-medicate it at that time. Till a level you can do it, but you will know it that it's too much pain. Then you go for your doctor.
So in case of anyone wanting to visit you and see you, they can also do that in Guwahati.
Yes.
They can come looking for you at the Apollo Hospital.
Yes.
Okay, I think we will mention like I said, we'll mention your details, and whoever wants can come looking for you as well.
Anyone can visit me in Apollo Hospital.
Well, Dr. Ghosh, thank you so much. This has been very insightful, and I personally learned a lot from this conversation. So let's all stay healthy.
Okay.
Thank you, Dr. Ghosh.